Hi, my name is Igweze Lilian. I'm a medical doctor by profession and a surgeon and reproductive health and rights advocate. My journey into surgeon and reproductive health and rights advocacy started in 2017, and my passion comes from my experience growing up as a young girl and from the work I've been doing so far. I come from a small village in Anambra State, eastern part of Nigeria. I live with my parents and I went to school in my community. Just like many girls in my community, I grew up washing my back. I had no form of sexual education and from my parents and from my teachers. In fact, it was a taboo to talk about sexual education in my community. Menstruation was mentioned in passing, and it is often accompanied by threats of how you are going to get pregnant if a guy touches you, and we literally lived in fear. So when I eventually started seeing my period, I was even scared to communicate to my mother because I feel like it's a disgraceful thing and I don't want to start receiving those stress of keep reminding me that if a boy touches me, I'm going to get pregnant and all that. So it really affected my self-esteem negatively. It was a challenging period for me. My self-esteem was so poor, and so was realities of many of my friends in school. I had no idea of the right material to use for my menstruation, and even when I learned about some materials, synthetic pads from my friends, there was no money to buy them, so we literally depend on clothing material or tissue paper. It was our reality. So it was really a sad experience for me. And my personal menstrual hygiene was very poor as at the time I was in secondary school. So I remember every day in school, you see boys mocking a girl because she has stained her clothes with menstrual blood, and the girls will always feel bad because we know it wasn't her fault. Again, some days we come to school and then a girl will start missing in school. Days will roll into weeks, and then when we make further inquiry, we'll find out that the girl has gotten pregnant and that's why she has stopped coming to school. And of course, once you get pregnant as a girl, you don't come to school again. So it was really a sad experience. And this experience I had years ago is still the sad realities of many young girls in rural areas in southeastern Nigeria. So this experience has fueled my passion, and that was why I started the Life Mother and Child initiative to bring together girls from different parts of Eastern Nigeria who are willing to share their experience growing up. Because we believe that if these young girls listen to our own experience and know that yes, we have been there and then we understand what they are passing through, they'll be able to relate with us and be able to accept our messages and also adhere to the things we are going to tell them. So at Life Mother and Child initiative, we empower girls with rights, sexual and reproductive health and rights information. We train them on skills to empower them, and we also expose them to opportunities that will help them to develop themselves for their personal development. So in reality, it is assumed that a lot of work has been done in areas of sexual and reproductive health, including sexually transmitted infection, menstrual hygiene, and contraception. But the truth is this: a lot of youths and young girls have no access to these services. Youth-friendly services are designed to address challenges faced by young people in accessing high-quality sexual and reproductive health and rights services. But the question is, how many of these young people and adolescents have access to these services? Ideally, youth-friendly services should be structured and should be centered on understanding of challenges and realities of young people. It should be readily available, accessible, affordable, and effective. Youth-friendly services should be structured on HIV testing, counseling and treatment, sexual transmitted infection testing and counseling and treatment, prescribing of appropriate medication and health products, pregnancy testing, contraception counseling and provision, maternal health services, and a lot more. However, not a lot of young people feel safe accessing youth-friendly services in our environment. Hence, there is need for us to work on trust and confidentiality in delivering these services. There's a lot of barrier facing young people in accessing youth-friendly services in our environment. These include laws and policies which require the young person to obtain consent from either their parents, their guardians, or their teachers to be able to access these services. This limits them to accessing it because nobody wants to relate why he or she wants to access these services to their parents, but they will feel safe doing so to the healthcare provider. So it makes a lot of young people not to access these services. The cost of service too is high. These services should be free, or at least have the price that is bare minimum that these young people can access, but ideally it should be free for them. There's also barrier of distance from facility. These facilities are not readily available in environments where these youth reside. Then there's problem of lack of privacy and confidentiality, because young people don't want to discuss something that's so intimate to them with anybody. They want somebody that can assure them that this information is going to stay with you without relating it to people that they don't want them to hear about it. There's also myths and misconception around contraception. Research also shows that providers' bias towards unmarried youth as accessing contraception is a persistent problem. Because if young person go to the facility to access youth-friendly services, if I'm the caregiver, I can decide not to, because the person is not married, because my religion forbids sexual intercourse outside marriage. I can decide not to attend to this person because the person is unmarried, without knowing that it is right of this person to access these services because it has been provided for them. So these barriers are what we are going to work on. If we are going to actually make these services available for the young persons, we need to work on these barriers. And for us to work on these barriers, we are going to look at the World Health Organization standard-driven approach for youth-friendly services. They have standard 1 to 8. Standard 1 is adolescent health and literacy. How are we going to educate these young people on their sexuality, give them the right education? Because it's not enough to educate them. It is even more important to give them the rightful education, age-appropriate education. Number 2 says community support. We need to work with community stakeholders to be able to know that human rights supersedes custom and tradition. So they should allow these young people to be able to access these services, and we need their cooperation to do so, to even establish this kind of thing in their communities. Then we have appropriate package of services. You need to, when I went for my training in Rwanda, there is a particular place where these services are located outside residential areas, but not too far from residential areas. And it is disguised in such a way that when young people go in there, nobody knows what they are going in there to do. Other services will be camouflaged to be going on there too. So these young people don't get stigmatized for going to access this kind of services. So the service should be packaged in such a way that young people feel safe accessing it. There's also providers' incompetencies. We need to work on providers' incompetencies. Providers should be able to be trained and also work on the right thing, not being biased on who is going to access these services and who is eligible. Then there's facility characteristics, then equity and non-discrimination. Young people should be able to access these services without discrimination of any kind. Then it should be data driven, and there should be quality improvements. When you are giving your services, you should also take your data to be able to evaluate what you are doing and know whether you are making the desirable impact, you are achieving what you are supposed to achieve at the end of the day. Then there should be adolescent participation. When you go to a particular community, you should be able to involve the people that are going to access these services to make sure that you are even providing what they need. So to achieve equality for youth and young girls, the health service provider should provide quality services to all adolescents, irrespective of their age and sex, irrespective of their ability to pay, marital status, educational level, ethnic origin, and sexual orientation. We know that a lot of emergencies among youth and girls are tied to unavailability of youth-friendly services or bias in providing these services to them. Failure to provide youth-friendly services in our environment has led to increase in sexually transmitted infection, teenage pregnancies, illegal abortions, maternal deaths, and denial of access to education for girls who are pregnant, and a lot more. There are also complications of pregnancy in teenagers and poor neonatal outcome. Availability of youth-friendly services empowers the youth to make informed decisions about their sexuality. And this is what we do at Live Mother and Child Initiative. We go to the rural areas in Anambra State. Sometimes we go to places that are not motorable because these people can't even come to the city to access these services. So we go there to educate them, following the WHO standards. We go there to educate them, to make sure that they even know exactly what they should know and how to access these services. And we believe that if other non-governmental organizations and other government offices and stakeholders should put their hands and support non-governmental organizations to take these services to people, even in remote places, a lot of emergencies among youth will be curtailed, especially sexually transmitted infection, teenage pregnancy, and illegal abortion. So today, on the International of the Girl Child, I am adding my voice to that of United Nations Women and World Health Organization to say that youth has equal rights to services, which is their human rights. Thank you.